Before we get started today, a friendly heads up that today's video discusses medical trauma, which some viewers may find sensitive or emotional. Please feel free to skip this video or take breaks as needed. Your well-being is important. So today we have a guest, Dr. Aviva Gaskill, the owner of Seven Spoons Therapy, who is going to help us undercomplicate the topic of Ehlers-Danlos syndrome, or EDS. So welcome to Undercomplicating Stuff, where we, two psychologists and coaches with over 40 years of combined experience, share our insights to help undercomplicate important topics. A friendly reminder that this video is meant for conversational and entertainment purposes only. Please see the information section of this video for additional resources. So I'm Dr. Julie Radico. I'm a psychologist, a coach, an author, and a speaker, and I'm here with Dr. Stacey Gedian.
Hi, I'm Stacey Gedian. I'm a health psychologist and the founder and CEO of a healthcare consulting and professional coaching business. And today we're excited to have Dr. Gaskill. Can you please introduce yourself before we get started?
Sure. Thank you so much for having me. I'm Dr. Aviva Gaskill. I'm the owner of Seven Spoons Therapy, which is a therapy practice that specializes in health psych issues in general.
Let's kind of jump into Ehlers-Danlos syndrome, or EDS for short. Can you start us off by describing what it is, some symptoms, and if there are even different types?
Ehlers-Danlos is considered a connective tissue disorder. Like many things in the body, it goes down to a cellular and even molecular level in the body. There are 13 different types of Ehlers-Danlos syndrome, or EDS. There are some that carry different types of risks. The most common one, and the one that I will focus on with you all today, is hypermobility Ehlers-Danlos syndrome, which comes on a spectrum of disorders ranging from hypermobility spectrum disorder all the way to hypermobile Ehlers-Danlos syndrome. As I mentioned, the other types are considered rare disorders. Hypermobility, EDS, and hypermobile spectrum disorders are fairly common. The hypermobility type of EDS is really identified by a lot of joint hypermobility and instability, and then a lot of chronic pain frequently with it. A lot of people can do unusual things like bend their thumbs back to their wrists, bend fingers all the way back to touching their hands, or bending their neck all the way backwards to a 90-degree angle, almost like an owl. And a lot of people who live with this umbrella of disorders, right? So there's hypermobility, Ehlers-Danlos syndrome, but then there's other disorders that are really commonly comorbid or co-occurring along with HEDS. So those include things like dysautonomia, or POTS, which is a type of dysautonomia, which is postural orthostatic tachycardia syndrome, in which people often have dysregulated heart rate. When they stand up, they might get very dizzy, things like that. And then mast cell activation syndrome, which is a form of allergy, basically, where your mast cells can be overreactive, and that can be to certain types of food. It can be to your mood. It can be because it's raining outside. So that can be tricky. A lot of folks also have sleep issues, not getting into as many rounds of REM sleep as are typical. A lot of folks also have things like gastroparesis, migraine, Chiari malformations, autism, ADHD, and what we used to call PCOS, polycystic ovarian syndrome, which has very recently been renamed PMOS, which stands for polyendocrine metabolic ovarian syndrome. Those are just some of the comorbidities, but there are many, many. And so I always think of it as like EDS is sort of an umbrella of a bunch of different other conditions. We also have connective tissue throughout our body. So it's not just in our skin, but also in our organs. And so there's a lot of different things that can occur because of this connective tissue disorder. The folks who have created the criteria for the diagnostic criteria for Ehlers-Danlos syndrome are actually going to be updating the criteria, the diagnostic criteria for EDS later on this year. I believe it's in the fall or winter, like late fall or early winter. And so a lot of people are looking forward to that, because there are a lot of people who have sort of felt like they've been left out of the diagnostic criteria before based on something called the Beighton score. sort of hopeful to get a diagnosis of EDS because they feel like it'll explain a lot of their symptoms better than just being called hypermobile.
So that's really interesting that it sounds like this is evolving. So the diagnosis is evolving, and soon there'll be updates on the criteria. And I am really curious, you mentioned some sort of like score that people would get. Like, can you explain a little bit about that?
So I'm not an expert on the Beighton score. It's a score of different hypermobile joints that are really commonly seen in the body. So again, being able to bend your thumb all the way down to your wrist, being able to bend over and touch the floor very easily, bend over at your waist and touch the floor. I believe that that is a part of the criteria that are being updated diagnostically.
I really appreciate you explaining that a little bit to us and knowing that it's team treatment. So I'm hearing you say that there's roles for physicians in helping to diagnose this. I'm also curious too, as we're still digging into like what EDS is and how people might start to consider whether they have it or not. Like, so you're a psychologist, you're the owner of a group of, mental health clinicians. How do you play in the team that support people who have EDS?
I would say the main players are different types of physicians with different specialties. That can include cardiology, that can include gynecology, all different types. And then we also have PTs, physical therapists, or physiatrists are a big part of the team, oftentimes nutritionists, occupational therapists. And so there's a lot of folks, including psychology or other types of mental health therapy. We're a huge part of the team because anxiety and trauma are such a significant part of living with EDS for so many people. It's one of the biggest challenges that I get presented with in terms of working with this population. And then also things like brain fog, which also can create a lot of anxiety, right? But we can have tools. So even neuropsychology can be really helpful, understanding and helping people manage and offer different tools people can use when they're living with this.
I like that you're highlighting how it really is a team approach, and the importance that I take from that is hopefully everybody's talking. So whenever there's communication among team members, that certainly is helpful for clients that you're seeing. You mentioned early on that there's a continuum and there are several types of subcategories, I guess, of EDS or categories of EDS. And so my mind goes to, I wonder if people that have maybe milder versions or less noticeable versions maybe get sidelined or dismissed.
Yeah.
And I wonder if you could speak to that a bit and maybe some other barriers or challenges people struggle with from being taken seriously to getting a proper diagnosis and everything in between.
Even people with the full, who meet the full diagnostic criteria of hypermobile EDS or other types of EDS for that matter, often get dismissed, let alone folks who are on sort of the other, other ends or other fall into other places in the hypermobile spectrum. And that is one of the biggest challenges for a lot of folks. They oftentimes are coming to their doctors with symptoms and they feel like they're not being heard, they're not being understood. And that in and of itself can create a lot of medical anxiety. If you go to your physician and you feel like your physician isn't listening to you or doesn't understand, the experience that you're going to want to present to that physician again, or keep presenting to other physicians with the same complaints and continuously be dismissed is, again, what I hear a lot in my clinic, in my practice, that people are going to have a really hard time reapproaching again and again and again. I also want to say I went to a conference, of family medicine practitioners with a physician who specialized in working with people living with hypermobile Ehlers-Danlos syndrome and other hypermobility spectrum disorders. She asked a room of about, 20 or 30 physicians. I think I was the only non-physician in the room, or at least one of the only non-physicians in the room other than the person who was like recording the session. And she asked, how many people in this room have seen and know how to identify Ehlers-Danlos syndrome? Guess how many hands went up? Actually, all of the hands went up. And then she said, how many of you feel comfortable diagnosing someone with Ehlers-Danlos syndrome, and one person's hand went up. And this is primary care physicians, right? This was a family medicine conference. That is so telling, just the discomfort that a lot of physicians have. Fortunately, that's becoming, my hope is, less common, that it's becoming more common for people to start to feel comfortable with the diagnostic criteria. My hope is with the changing of the diagnostic criteria that it will be more inclusive and more physicians will feel comfortable diagnosing patients. But that is, such an important first step, is explaining this is a medical condition that you are dealing with. There are providers who specialize in this work. Even if that provider is not one of them, here's what we can do, or here's who I can send you to who understands a little bit more about different aspects of what you're dealing with.
That's so compelling to know that there's, in this room full of medical clinicians who really want to be supporting patients that they don't feel as confident as they hopefully could or should to be able to diagnose these symptoms. And so I'm curious, as we're thinking about this, and as we have listeners who might be considering they have this, or anybody in their lives might be experiencing, who's at risk for any type of Ehlers-Danlos syndrome?
An estimation that the hypermobility type of EDS, and again, this is a full diagnosis of Ehlers-Danlos syndrome, not inclusive of just people who are hypermobile and on the hypermobile spectrum. It's estimated to affect 1 in 3,100 to 5,000 people. So again, a lot more common than I think the diagnosis is actually given. In my experience, and I'm going to be very careful about how I say this, women seem to be more at risk for symptoms because of hormonal involvement. Boys and men, I will see sometimes be hypermobile, or what I say to people is, were you considered double jointed as a child, right? We used to talk about that in the 80s and 90s. I'm double jointed, or you're double jointed. It turns out that a lot of those people are actually hypermobile. But what we see is frequently that a lot of folks, boys will sort of have more symptoms prepubescently, and then it flips. And then we see a lot more girls, young teenager females, living with hypermobility. Unfortunately, what I then tend to see is in perimenopause, menopause also, that people really start having symptomological flares. I think that there's also a risk for boys and men who have long viral syndromes, right? So I've seen men who either have either some sort of head injury, head trauma, have a resurgence in symptoms of hypermobility, and then or men who have had some sort of long COVID or other kind of illness like that. That being said, there are plenty of men who have it otherwise, right? And there are lots of women who do not have these symptoms. And it really can impact anyone of any race or ethnicity. There seems to be a hereditary component, but especially with the hypermobility Ehlers-Danlos syndrome, the researchers haven't necessarily identified one specific gene or even a specific cluster of genes. So they're really focusing and working on that right now. We can talk more about the medical trauma piece, but one thing that I think comes up when I hear people talk about the medical trauma and the dismissal that they experience is, we know as health psychologists that people who are female or femme appearing, people in the LGBTQ world, people who are people of color, right, Black, brown folks, people who are very young or very old, tend to get dismissed a lot of times by the medical system, and their symptoms tend to get dismissed a lot. So a 15-year-old girl presenting with these symptoms, and I'm saying, well, I'm having a lot of pain and my period is really bad and it's really, really heavy. And it's going to be a lot harder, I think, for a lot of young women to get their message through to their doctor, and not to any fault of their own. But we know that there's bias in the system. And so that really comes into play here quite a bit.
And that really speaks to your earlier point about the prevalence of the hypermobility version, and the fact that it likely is an underestimate because it's probably underdiagnosed, and particularly in the populations that you mentioned. What would you recommend that someone do if they suspect that they may have this going on in somewhere along the continuum, but feel that either a loved one, let's say the adolescent girl, right? What are we going to attribute it to? Where I was, let's say a loved one or even a medical provider really is just not maybe listening, or the client's not feeling like they're being heard. What would you recommend they do to help advocate for themselves?
A couple of things, right? One is, don't give up. right? First and foremost, because at some point someone will listen to you, and really watching this condition becomes something that we're understanding more of, we're seeing more of, and it's going to become more commonly diagnosed, right? So that is number one, is like, don't give up on yourself. Don't let anyone tell you that you're not being truthful, or bring someone who is with you, who is listening to you, a family member or a friend, as an advocate to your medical appointments. Make sure that you have someone who understands you, believes that you are being truthful and honest to your medical appointments. One thing that I think can look funny, I'll say, to family members or friends or physicians is, this is a condition where you're going to have days where you're going to feel great, and there are going to be other days that you're not going to feel as good, and you're not able to do as much, and you're much more prone to joint injury, for example, or having an allergic reaction because of mast cell activation or something like that, or you're having a lot more dizziness, right? And so you need to not gaslight yourself. You need to make sure you believe yourself. Go onto the Ehlers-Danlos Society website. There is so much information. I have patients who find me there. There's video content for learning. There is a lot of reading. There's a lot of research on there, and you'll see a lot of people. And I think you guys might laugh at me, but the song "Sisters Are Doing It for Themselves" always comes into my head when I go to the Philadelphia area, which is my area. Ehlers-Danlos Facebook page, right? There are local groups of people all over the internet who are trying to help each other, to find physicians who believe them, to help each other out. And that feels really important too, that there are people who will believe you, who understand you, who understand what you're going through. And that feels so significant to me, is there is social connection out there, and there will be people who get it because they're dealing with that themselves, or their child is dealing with some similar things. And that's so important.
It sounds so important, as we all know, to have community. And it sounds like in this EDS community, like, people get that. And you can look online at certain websites or certain Facebook groups, or even just in your local community, for people who can validate your experience and also maybe give you good resources for psychologists like you, Dr. Gaskill, who get it. I'm wondering what myths might exist related to EDS.
That's a great question about myths. I would say the big ones that I see and hear are that EDS or hypermobility aren't real, that they're in your head, right? Or a lot of people end up leaving their doctor's appointment with the experience that their doctor was telling them it's all in your head, right? Or that it's all psychological. And one of the first things that I explain when people walk into my office is, I am both glad you're here because the anxiety part is real. The trauma part that you may have experienced via medical trauma is real. And at the same time, it's not all in your head. I know your pain is real. You are having very physical pain, right? Your joint subluxation that you might be experiencing, right? Or joint dislocation, right, is very real. There are a couple of other myths, which include that this is like a white person's disease, or it's only impacts women, and also that no one will believe your pain. There are people who will believe you, and there are people who will understand that what you're going through is real. People are always surprised when I talk about the hormonal component, and we're starting to learn more and more, particularly about the impact of progesterone, and even a little bit about testosterone on EDS. And so even just if you're someone who experiences a period, you may have more symptoms or more injuries, for example, or right before you have your menstrual cycle. And I think that's something that's really important too, that even within a monthly period, there may be a flux of symptomatology.
In speaking about myths, I've heard along the way that there are things in one's environment, or maybe even things that people eat or are exposed to, that might contribute to the different types of EDS. And I'm wondering if you could speak to that a little bit.
So I don't want to overspeak. EDS is an autoimmune condition. And so first of all, people can have sometimes many autoimmune conditions at one time, or there's an autoimmune component of it. And so that's important for people to know, right? You can have other autoimmune conditions. That could be something like vitiligo, or that could be something like multiple sclerosis, and you can also have EDS. Again, we don't fully understand. Researchers are really, especially with the hypermobile EDS, are trying to really understand the genetic factors, nutritional and environmental factors, and even trauma and things like that that sort of come into play when someone develops hypermobile Ehlers-Danlos syndrome.
As we're talking about this, I am so happy that there are psychologists like yourself who are out there who have in-depth, thoughtful knowledge about EDS and even just the different types about it, right? Like, and that's why we think this is such an important topic, because I have limited knowledge about this area. And so wanting to hear your expertise, and I think it might be helpful for our listeners if they were going to see you in therapy, say they, have a type of EDS and they're coming to you to help maybe with anxiety or other facets that you tend to see, what might they expect from working with you?
Yeah, it's a great question. So there are a few things, right, that I really like to look at in the beginning. I always ask people about medical trauma. And even when I'm working with someone where I'm not sure, I don't have an indication that's clear, from the get-go that that is a part of their story, pretty much inevitably, it always ends up being a part of their story. One of the things I always start to talk to people about is one of the hallmark symptoms of dysautonomia can be tachycardia, right? So a racing heart. And so that can happen randomly. And I will ask people about anxiety versus tachycardia. And do we know if you're having one or the other, or sometimes both together? Because that can happen as well. And trying to look for things like that. And then we'll also look at their support system, right? Anyone with any kind of chronic medical condition, who is supporting this person in their life is such a big factor. Can that person listen to them, ask them questions, not be someone who's gaslighting them, attend doctor's appointments with them, be their non-drinking buddy who leaves the party early with them when they need to go? Can that person learn on their own a little bit about EDS or hypermobility spectrum disorders in general? Can you bring that person meals that they can eat that are safe foods for them? Can you help them with medical decisions or other decision making on the days when they have very severe brain fog? That's something that you can do.
So much useful, important, new information, at least for me, that you shared today. And we're so appreciative, and imagine that our listeners will also learn a ton, even though it's just the tip of the iceberg from what you're describing as the variety and the continuum of EDS. And if I look at my takeaway, you just said it a moment ago again, don't gaslight yourself. I love that. And listen to yourself, know yourself. And maybe tied into that, I was thinking about what one can do to advocate for themselves and a loved one who has someone that might be struggling with this. And it might even be keeping notes and keeping track and keeping a calendar of symptoms since they change, so that that can also help you to believe, no, wait, this is real. This is happening. This is a real thing that I'm struggling with, and I need to continue to persist.
So my key takeaway builds on yours, Stacy. I think this is such a complex, layered, important topic and issue and potential diagnosis or diagnoses that none of us are experts in. And like Dr. Gaskill has really tried to help us dip our toes into the waters that are trying to understand this complex diagnosis that has so many comorbidities. And my encouragement would be start to ask yourself thoughtful questions about what you're experiencing and to reach out for support in all the ways that you feel capable of. So whether that's local communities like a Facebook group, if it's on the websites that you'll find the links for in the description of this video, that's going to your primary care clinician. And even if they don't know exactly how to give you the diagnosis, to ask if they could refer you to somebody, or not to stop there, but even look on the websites of who might be other clinicians that you could go to. Maybe you need a referral to them, but you could ask for that instead. Trying to really meet yourself where you're at and give yourself the opportunity to explore all of the resources out there to try to figure out your experience that's true for you. I'm really curious, Dr. Gaskill, what would you hope our listeners carry with them from our conversation today?
Yeah, it's a wonderful question. I think the main thing is, if you are someone who lives with Ehlers-Danlos syndrome or any form of hypermobility or any other form of EDS, is get help. Do not give up on yourself. And then for the people who are loved ones of those who live with EDS, make sure you're listening to the people who you love. Right? Ask questions, believe them, right? When they tell you they're having pain, believe them and talk to them and ask them more about, their pain and how you can help.
So if this topic resonated with you, please share this with somebody that you care about. You can also find resources about our discussion today in the description of this video. Also, please comment, like, and subscribe. You can listen to our podcast on YouTube, Spotify, and Apple. You can also message us on YouTube, Facebook, Instagram, or LinkedIn with suggestions of questions and guests that you'd like us to have on future episodes.